the Stronger Inside podcast, where we break down all things regarding health, fitness, and wellness to help you improve your mind, body, and environment. And now, your host, Wayne, a.k.a. Workout with Wayne, and Ernest, a.k.a. Mr. 100 Pounds Down.
What's up? What's up?
Good, man. What's up with you? Staying stronger? Keep the shirt.
There we go.
There you go.
There we go. It's a statement. Making progress.
All day, every day.
Yep. So, episode 25.
25.
It's a lot of episodes, man.
Yeah, man. We a quarter of a way to 100.
There we go. Little reminder, we are going to keep a YouTube exclusive for the near future so that we can continue to build our subscribers up and people can really come give it a chance and see what it looks like in terms of YouTube versus the just audio listening.
The listening experience.
There's some effort and additional facts and things that go into it.
And overtime.
And the overtime exclusive to YouTube.
Woo. That's going to stay on YouTube. Even if we go back to those other mediums, it's going to stay on YouTube.
The overtime is only on the YouTube. So episode 25, we finished up our macro series with 24.
Yep.
So now we're going to take it to something a little different.
25.
Episode 25.
So we're going to talk about why running sucks.
Running sucks.
It's the worst. It's just the worst. Like your legs got to be moving and stuff.
I'm just going to say it.
Say it. Say it with your chest.
Running sucks. But, like, how can you say that? You're a personal trainer.
Because you're honest.
How can you say that? How did you lose 150 pounds?
It wasn't about running.
Wait, that's not possible. So,
but here's how.
I just want to get into the reasons why running is so hard on the body and really kind of open our listeners' minds to other alternatives and other things. And then after that, you can form your own decisions.
Absolutely.
You're an educated adult, and you know, if you want to go run, go run. Have at it. But at least know why you're doing it and the dangers ahead. No, dang, we make it sound like it's a drug or something.
Yeah, I think this is the point when you add the dun dun dun.
Exactly.
Yeah.
But it can be. So trust me, I've seen a lot. I've seen a lot of stories. I've seen what running can do to the body. So we'll jump into it that way. Why do people run?
It's probably one of the easiest things to do for physical fitness. You don't need equipment. All you need is a pair of shoes.
You don't even need those. See, you spoiled. First world. Look at them. Man, we got listeners all over.
All over the
shoes.
Globe. International podcast.
Shoes.
What are those?
What are those? Literally.
What are those?
Literally. What are those?
Okay. You're right. You don't need anything to run. All you need is your body.
There you go.
There you go.
There you go. So that's one of the reasons why people run right there. I think that's one of the top ones in terms of it's the easiest thing to do. Second, I would say it's something that you don't have to, you should know how to do it because believe it or not, everybody doesn't know how to run.
Have you seen Phoebe Buffay run from Friends?
Oh, no.
Oh, yeah. She just runs, she flails her arms all around.
I've never watched Friends.
I'm sorry.
Sorry. Yeah. Don't apologize.
It's a great show.
Don't apologize, man. Do your thing. Yeah. But running, it's easy, but then also you don't have to know how to do anything in terms of like weight training. There's less intimidation factor. You're not worried about form. You're not worried about any of these things. Basically, you're just like, I'm just going to go run. So that's another reason right there. But I will say this. I think after that, the top reason is weight loss. People just believe that I'm going to burn more calories by moving, i.e. running, and then I'm going to get the desired physique by running. And, you know, that's not the most efficient way to necessarily lose weight and get to where you want to get to. It's all about your goals.
Right.
Because very few people run because, one, they want to become a better runner. Two, they like running. So, because I'll do my consultations, get new clients, somebody come in, and I'll ask them what they do, what type of stuff they do, and they say, well, yeah, I don't weight train that much, I don't have that much experience, or, I just haven't been spending time, but I do go out for a run, or I do this. And I'll ask them, do you like running? And it's never excited, yes, I love running.
Yeah.
It's just the best part of my day.
Mm-hmm. You got to justify it some type of way.
It's well, not really, blah, blah, blah. And that tells you right there, it's like you're just doing it. And we don't have to do stuff we don't really like if there are a lot of great alternatives.
Absolutely.
So if you like running, keep running. If it's not hurting you, keep running. And how many people can we say that are in that boat? Because we'll get into that a little bit later. Yep. I'll say this also. Some people like to think of it as a challenge. Even though they don't like doing it, it's this badge of honor. Well, I ran 5 miles. So it was hard. They did it, which, hey, doing hard things builds character.
Right.
But if you hated it the whole time, you shouldn't. Maybe if you did it once,
right?
But to do something consistently that you don't like, to have this badge of honor, it's not worth it.
Right.
It's not going to be sustainable either. What's the longest distance you've ever ran?
I ran a 5K last year.
Okay.
Yeah, that's the longest distance I've ever ran. With 3.4, 3.2 something miles. I don't remember exactly what it is, but yeah, a 5K.
Okay.
Yeah, so that's the longest distance I ran. And, working out with you, it wasn't a lot of running in the beginning, right? After I got lost quite a bit of weight, the running could be easier for me especially on my knees and my joints and things like that. Mm-hmm. We began to gradually incorporate runs and things like that. And so as we started doing it, I hated it, but it was part of the program, and so I was invested in the program, and I wanted to get the full benefits of it. But as we started doing it, I started enjoying it more, right? I started enjoying it more, and then I wanted to get better at it, right?
Yeah.
Wanted to go faster, go further with that same time, or that same pace, right? And so by the time I got to the point where I was ready and able to do a 5K, that distance, although it was difficult, at no point during the race did I feel it was, or during the run, did I feel it was harder than any other type of a distance, right? And I told my wife when we were done is that when there was a point where I was mentally, my body was on autopilot a little bit as I was running. I had my headphones in, I was just kind of going, and something had to snap in me a little bit when I got closer to the end, where it's like, oh, I'm still running. Right, because I wasn't even thinking about the movements and the steps and the things like that. And so, but yeah, the 5K, that's the furthest I ran, and it was one of the probably a pretty good. I kept my.
Was this last year?
Yeah, it was last year.
Last year.
Yep, and I kept my mile. I pretty much kept my mile pace for the duration of it, which was I was impressed by that in itself. Yeah.
Yeah. Cool. Yeah, I would say for me, I've never been part of an official race. Mm-hmm. I just haven't ever had the want. But in terms of doing on my own, I want to say about maybe like 2.5 miles. Yeah, about 2.5 miles. That's the most through training, just to for basketball and stuff like that. It's more stop and go. There's more plyometrics. It's fast twitch stuff. But to really build a nice aerobic base, you should still be able to run about 2 miles, and that's as far as I would go. So 1 mile, 1.5, 2 miles at the most. So I really don't have experience running, anything longer than that, because I have never had the need to, right?
Ever desire to run a marathon?
No. I think I had this conversation with a couple of my clients once.
It was the look. The look was like he's processing this, but then the words was like, no, he was trying to say it the nicest way without cussing. But go ahead.
It was would you rather run a marathon or this, this absurd amount of burpees? I was like, I would rather do the burpees. Because you can rest.
Right.
Like I just that long distance of just keep going and going and going. It's just not for me.
Right.
And to be honest, everybody's built differently. You can't be Usain Bolt and be the Boston Marathon winner.
Right.
So there's a completely different makeup. I'm closer to the Usain Bolts of the world in terms of muscle fiber.
Right.
I'm not a gold medalist. I'm
Right.
not trying to say. But what I'm saying is, but I would say in my prime, I'm an old man now. I'm 36.
Right.
I was a pretty explosive athlete, and meaning that you can't have both. I was never going to have the fastest, even mile time, even 2 mile time. There's people who are better suited for that. And if you look at professional races, you will see who's better at that.
Right.
And it's not all just nurture, it's nature involved as well.
Right.
And if you go look at the 100 meters and you see how those people are built, and that's what they're built for.
Right.
Yep.
Fast twitch.
Exactly. So, we already said some harsh things about running, but before we go too far into that, let's be on the nicer side. Benefits of running. The benefits of running. What would you say some benefits that you felt when you began to run a little bit more?
I feel like my cardiovascular stamina increased as I began to run more. I felt like the time, like the personal time to myself, was very freeing and was able to clear my mind, get some thoughts out and placed. And, it was because even when you're working out, I think working out in general is a great opportunity to kind of be focused in on yourself or anything that you have to deal with or want to process mentally.
Yeah.
And so especially when you're out running in nature, not just on the treadmill, but out running in nature, running on the street, running a track or whatever, I feel like that was a great opportunity for me to really clear my mind and have that mental break and space for those types of things. I also, what else? There was weight loss benefits as well with it. But as I was running, I was also weight training too. So it was never just a running program.
No,
right?
You were in a caloric deficit.
I was okay. Right. But so being in the caloric deficit, but that was also, incorporating that into my day was just it was just a change of routine, or it kind of continued to allow the program to not be stale and stagnant, because we incorporated longer runs, mile runs, things like that, but also we incorporated sprints, right? So we did 100-yard sprints and things like that, and so it was running was very therapeutic for me, I feel like.
Yeah. It is. Last spring, I just did a mile a day. I just challenged myself. I ended up doing it for about 35 days, where it was just a mile a day. And it does. I mean, you have that time, you think, just you're outside, preferably, you don't want to be on the treadmill. We'll get into the, difference between running and outside in the treadmill later on. But just that kind of mental health benefit of there, just kind of being outside, being one with yourself. And then also, yes, cardiovascular health matters. So you're going to greatly reduce your chances of cardiovascular disease, even some types of cancers, like all these certain things that come with, lowering your blood pressure. You want to have a sustained elevated heart rate, depending on your goal or whatever, but at least, maybe 40 minutes a week. So that's something that you should be doing, but you can do that in a couple different ways. It doesn't have to be running.
Right.
But yeah, so there are the benefits of running. All right. But now let's get back to the dark side. The cons to running. What's the first thing that comes to mind for you?
Pain. Yeah, knee pain, ankle pain, foot pain, all the lower extremity pains that come with running, right? I think one of the side effects of my weight gain is that I have some cartilage in my knee that is no longer there. Not as much as probably should be there, right? Okay. So there's some early potential arthritis type things going on in my left knee. So I have to be very careful and make sure I don't run too much, or sometimes my knee gets a little sore, even for long car rides and things like that.
Yeah,
my knee being bent in that position, I have to get out and stretch sometimes. But yeah, so that knee soreness and those pains are really something that I think about when I think about running.
Yeah. Yep. Pain. About 80% of injuries related to running are going to be just from repetitive stress. And that's what it is. It's just repetitive stress. You're just going over and over and over and over again. And I like to give the analogy to get people to really think about it. Think about your car, right? Your car gets alignments. You get new tires. You get a change here or to this side, to that side, so that things can run smoothly, right?
Yep.
If you're not going to do that to your body, what's going to happen, right? Because the reason, you ever had a car, if you let the steering wheel by itself, it kind of goes.
To one side,
yeah. Imagine if you never changed that and you just kept that going, and then you go to the mechanic or you look at it yourself and it's like, well, you have a lot of wear and tear on this side, or, this brake pad is worse than this side. You have to do things to make it even so that it runs efficiently, right?
Yep.
It's the same thing with your body, but most people are not doing that. So when you have a lot of these injuries, and we'll go down the list, is like, if you're not doing corrective exercises outside of running, because running is not a corrective exercise, it's just exercise. If you're not doing corrective exercises to make sure that you're moving efficiently, you're doing yourself a disservice, and now you're going to get more tread wear and tear with the inefficient movement pattern.
Right.
So now, if you got a little jerky here because your left ankle hurts, and then you run for 3 miles a day for 6 months, then your right knee starts hurting. Then you get a hip problem,
right?
And it's just like it's a compound effect because you're not making sure that everything is aligned properly. So it's really important to understand that if you're not going to put yourself in the best position to run in terms of doing some of the things that we'll go over, you're just moving inefficiently, and it's going to lead to injury.
Right.
Like it's only a matter of time. It's not a if, it's a when.
Right.
Yeah.
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 That was one of the things that really precluded me from just taking up running, especially in the early stages. That's one of the things that I was like, I'm not really going to be running a lot. It's because as I carried, 100 more pounds before I started running.
That's one of the number one reasons I didn't have you run early on.
Right. My back.
If you're 400 pounds, long cardio should not be your go-to. Or excuse me, high impact, something such as running. And I even cringe because you can be overweight and athletic. I know this. I've participated, but there's people, the guy who has the best body fat percentage is not the best football player, basketball player, baseball player.
Right.
You can be an overweight, athletic person. Charles Barkley.
Shaquille O'Neal.
You know what I mean? Well, as he got older. Yeah. But when he came into the league, he wasn't.
He was
exactly.
Cut.
So what I'm saying is, if you were that type of person, yeah, you can be explosive. Zion, who's been a polarizing figure, Zion Williamson, that everybody's talked about. They've been talking about his weight since he was in high school.
Right.
He's explosive. He's one of the most explosive human beings we've seen. But his weight has to be monitored because the impact. And if his movement patterns aren't efficient, it's not if, it's when. And he's been injured in high school. He's been injured in college. He was only there in college for 1 year. And then he's been injured last year as a rookie. He got injured in summer league and he didn't finish the season last year.
Right.
So you got to say, if you're not putting yourself in position in terms of, like I said, you were at a certain weight, I didn't need you to run.
Right.
Because you were going to be doing more damage. and we could get your weight down, reduce any chances of damage, and then you're in a better position to run later on.
Correct.
And that's why you're able to do that.
Mm-hmm.
So that was one thing I wanted to point out, to where, yeah, if you're that size, and I see this stuff on Instagram, I've seen people, they're doing box jumps, they're doing, you know, different types of plyometrics, and I'm like, that's great that you can do that. But if you're not being guided under a professional, where they're either like counting the amount of jumps you're doing and different things like that, you're going to have a lot of wear and tear on your body. And even for a person who is at a healthy body weight, to, you know, come down from a jump, or, you know, to go play basketball, you know, think about Zion. He's 250 plus pounds. He jumps. The rim is 10 feet. He's 11 feet in the air at least.
Mm-hmm.
And what goes up must come down. The impact.
Right.
The more weight you have, the greater the impact, right?
Mm-hmm.
So you need to keep yourself in the right place. So don't just go do a workout that you found online or somebody's doing, and you are, you know, 100, if you need to lose 100 pounds, 150 pounds, because you're going to lead to injury before you get to the results you want. You're not going to expedite the results by doing something that your body's not ready to do.
Correct.
You know, just some type of burpees or something like that. It's like, no. Take your time. Lose the weight first. And then as your body's more prepared to do it, that's the best way to go about it.
Absolutely. Because again, if I would have did it in the beginning, I probably would have suffered from a lot of these things, because my back would tighten up on me when I started running. Within the first, 50 to 75 yards, I start feeling it in my back. But if my program said run a half a mile, I was probably going to run that whole half a mile. Yeah. And then as I ran, my back would have started to season up. Then I had to overcompensate for that. So now I'm running more straight up or something like that. Yep. Now my hips are going to be hurting now, or my knees are going to hurt. So those are the things that can compound when we aren't in the best physical condition to be doing that, or we're running just for the sake of doing it and not doing it the best way without being properly prepared, right? Yeah. And then running without stretching,
or just being warmed
up. Yeah. So warming up that body before we just take off and start sprinting down the street.
Yep,
is a key.
Yeah. So what we just talked about, that impact, that can lead to stress fractures. Mm-hmm. You get those small hairline stress fractures, even anything.
John Walls. I call them John Walls.
You got a lot of those. Yeah. Or even worse. You could lead to a huge break or something like that. So just understanding that's a huge common injury, to where you thought you were doing something and now you're in a boot for 6 to 8 weeks.
Right.
You don't want that.
Nope.
Then you have shin splints. You have those that occur if your movement patterns aren't correct. If you are doing too much too soon, then that will lead to shin splints. And to where the only really remedy, you can do some different types of stretches. You can do some different types of icing, things like that. But really, it's rest. So that means you were doing too much too soon.
Right.
So shin splints are a very, very, very common one. And then plantar fasciitis, to where now that plantar is under the foot. So you have people who are having a lot of issues with that. So those are very common injuries that come with running, and they can be avoided if you're doing other stuff. Have you had any, other than you said your back was getting tight, anything else?
Maybe some hamstring. Especially when we started doing the sprints, just that explosive movement would be tight on my hamstrings sometimes. But I think that was probably more cause of maybe improper warm up prior to, so that was probably more on me. I feel like I was in the shape and conditioning to do those things, because there's some days I can get through them all, and some days when I got to 8, it would seize up on me or tighten up on me. But other than that, it was just the normal, I guess regular, leg fatigue the next day, maybe something like that. But nothing ever that would put me out of commission for any extended period of time.
Yeah.
What about you? Any running related injuries?
No, because I wasn't doing it. Really, for me, in terms of the way I have a slight pelvic tilt, anterior pelvic tilt, so where it's my lower back will get a little bit tight. I actually did have some issues a little bit with it, especially when I was younger, to where it's just, and really it just was my abs weren't strong enough. My lower back was getting tight. My glutes probably weren't strong enough, and I just wasn't able to stay in that position. So that I was having an excessive kind of arch slightly in the back, and then that long. That's why, for 400 meters, I'm good. 800 meters, maybe for a mile and a half, that starts to happen. So the more I run, the better it gets. The more corrective exercises I wasn't doing that back then,
Right.
But now it's like, yeah, I can work to correct that.
Right.
And then the more that I did run in terms of those short distances, my body did get used to it. So that was something right there. And again, that's looking at my movement pattern. I can see the way I walk or I stand, and I say I have to work on that in order to be better at that.
And like you said, corrective exercise, and that really kind of hit home with me too, because like I said earlier, stretching. Because before, maybe not before running, but there were times within the workout program that you would have stretches on the day's activities, right? And I'd be like, stretching, I'll do that later. And then later never comes, and I'm like, it was just stretching. It doesn't really matter.
Yeah.
But then when you start running, like those stretches come in handy, right? Either before and after the activity, because you want to, again, warm up the muscles, and then afterwards, they were beneficial because they allowed you to kind of, like you said, realign certain things, and you realize that there are certain stretches that are more beneficial for running, like the runner stretch, right? So those types of things where you are really opening up your pelvis, you are really stretching those legs, you're really engaging your glutes and your hamstrings and things like that, because those are, it's not just about how much you can pick up and put down, right? It's about how flexible can you be, right? And flexibility, I think, is also important when it comes to being able to run, and especially in your hips and things like that. So those stretches really are beneficial for running and just in general. Yeah.
To where you're gonna have more efficient movement patterns.
Right.
And that'll lead to another common issue, IT band syndrome. So your IT band is connective tissue, and it's going to go from your outer hip down to your knee, right? And a lot of people have issues with that. It helps stabilize the knee. And so some people they're in and out of PT. They're in and out of PT all the time, and it's because, and they know this is true. If you're a physical therapist, or if you're a person who's been in and out of it, they tell you what to do. You go there for a couple of weeks, right? You go there for a couple of weeks. They work with you. They see what's going on. And then they say, hey, it's time to release you back to the wild. Here are things that you should continue doing so that you don't end up back here for the same reasons. People stop doing them. They stop doing.
I feel better.
They feel better. And then also, like you said, it's just little. It doesn't matter that much. Right. So kind of the same thing with certain stretches or certain things. It's like, no, those things are very important so that you can continue to improve that, So there's a lot of different reasons why you could have IT band issues. So understanding that if you're having issues in the knee, the hip, the ankle, and you need to go see somebody, to specialize in that and go to a physical therapist, go do it.
Right.
If something's lingering longer than a week, 2 weeks, go do it.
Right.
Figure it out, because you don't want to continue driving on that poor alignment.
Right.
Yeah.
Pro Therapy podcast.
Pro Therapy.
Yeah. Yeah. So it's all, if you need counseling in any part of your life or therapy, seek it out.
Well, it's important to understand that there's people that specialize in everything. I'm in an interesting place to where I know a little bit about certain things outside my main job. My main job is to, in a safe way, get you to learn and execute physically, doing the right things. So learning how to deadlift, improving your movement patterns, getting you stronger, getting you faster.
Right.
That's my number one job.
Number one.
But what do you think the number one thing people come to personal trainers for?
Lose weight.
Correct. So that's why I need to know about nutrition. And then if you're going to be a person who's working and trying to improve strength and speed, what's possibly going to come? Injuries,
yeah.
So I need to know a little bit about corrective exercise to maybe prevent you from having something happen to you, because I can see it coming and say, okay, well, you have a knee valgus where that goes in. We need to strengthen those muscles, and we're going to make that part of your program.
A knee what?
Valgus, to where...
A knee valgus.
Interesting. RG3. He's a guy who's had a lot of knee injuries, right? He, as a person, if you look how he kind of ran and walked, like he had where his knees went in, and it's like, I'm pretty sure he had amazingly qualified people around him. I don't know if they tried to work with that or if he did not want to work with that, but it's just something that stands out, and you go, wow, that's moving at those speeds at that level in an inefficient manner is going to lead to an issue. It's going to be a problem, right? You know,
so most people call that like knock knee.
There you go.
But knee valgus.
Yeah, there you go. Come on, man.
There you go. I like it.
Yeah, exactly. So just seeing those type of things to where you can say, okay, well, that's going to be an issue, and we need to stop that beforehand, and then you improve it, and then things work fine. So yeah, if I see something that I don't know, say go talk to them, go see a PT, go to your doctor, go to a licensed dietitian. Like, go if you're having gut issues or something, like that's not my job.
Right.
I may know a little bit about something to have a discussion, and I can dig further into that, but that's not my main job. My main job is to help you deadlift more, help you improve, your sprint time, your mile time, be able to do pain-free things with your grandkids and to be structurally stronger. That's my number one job. And
you do it well, sir.
Thank you. Thank you.
Welcome.
I appreciate that.
Yeah,
in terms of those injuries, I mean, people listening right now, they're probably dealing with them right now. And there's a million. That's why I use all these things in terms of foam rolling and these massage guns, therapy guns. All these different things are becoming more and more popular because that's almost kind of the immediate fix to make me feel better now.
Right.
They can be used and incorporated into a long-term program, but the average person is not doing that. They're saying, let me feel better right before I go do it. Let me feel better right after I do it. They're not having a long-term plan saying, how can I run this 10K 6 months from now pain-free? That's usually not the mindset that I see.
Right.
Yeah. So let's talk about some alternatives to running, because there's other stuff you can do.
You don't say.
How about this? Walking. And I'm not a huge fan of walking.
Yeah.
I've been on record to say, unless you are an elderly population, walking is transportation, not exercise.
There we go.
But if your goal is to lose weight and you're trying to get in a caloric deficit, you can walk versus run. Just going to take you a little bit longer. You can even, and it depends who you are. If you're a youthful, athletic person already, no, you don't have to walk. You can, though. You can put an incline up on the treadmill. You can go outside and go for a 2-mile walk, whatever, and just kind of do that. Because if your nutrition is on point, then you're okay.
Right.
That's why you don't see bodybuilders doing a lot of running. But they have such a low body fat percentage. How did they get there? They must run all the time, right?
All the time.
No, because those long sessions of cardio like that, talking 30, 40 minutes like that, is actually going to kind of contribute to muscle breakdown, which is the opposite of what a bodybuilder or physique type person wants, right? So they're going to do something that's a lot low intense, and that's why you'll see them. I mean, if you go to any of these gyms where they're actual competitors, whatever, you'll see them on the treadmill, on a steep incline, or on the stair stepper, or even an elliptical, and they're just kind of just going through, because they're like, I'm already in a deficit with my nutrition, and I'm going to burn X amount of calories without without muscle damage. It's hard to sprint, right? It's not hard to walk down the block.
Not
right?
Not as hard.
Exactly. So if you're already in a deficit and you're walking, then you're going to stay in a deficit, and you can be ripped and have poor cardiovascular health. That's the thing, right? So just understand that you can do that. Rowing.
Yep.
Low impact. So now I love incorporating the rower in there, right? You hop on, learn how to do it the right way. You can do different timed intervals. There's a lot of different ways of doing it, but now you're not having the impact on your knees. Right? Then there's a little bit more strength. Your upper body's involved. Your core's involved. It's a good change, right?
Yep. You got to be coordinated for that.
Swimming.
Yeah, you got to know how to do it the right way. There were some rows I was in. I was like, wait a minute, I'm not doing this right.
Practice makes perfect. Swimming is great. That's why you see elderly people and also obese, large people, they do water aerobics.
Right.
Why is that? Because there's no impact. They're lighter in the water. They can move their weight around, and they're not going to have those issues with the joints.
Yep.
So if you're going to go do that, or you're going to go swim, you're still burning calories. You're still working. You're just not, pretty much damaging or having that impact
on those joints.
Exactly. Swimming's great. I did swimming not last summer, but the summer before. It was a great workout. I knew how to swim, but I wanted to clean it up. Right. And I would my sessions were only 30 minutes. And it was a good workout. That was different muscles that I weren't using, but from a cardio standpoint, I could feel it. Right. And I didn't have any after effects of like when I did running every day for a mile a day for 35 days. I did start every now and I was like, okay, I could feel a little something in my knee. I could feel a little, it was nothing major and I got over it, but you're not going to really get that with swimming unless it's a shoulder issue or something, and that's going to be something maybe just, again, you might have to do corrective exercise for that. But if you are doing other things, you're going to get that same caloric burn. You're going to put yourself in deficit with your nutrition. You don't have to run. Sports.
Love those.
If you still participate in sports, I know it's been a lot tougher. A lot of pickup sports and things like that have gone away and probably slowly coming back. But flag football, basketball, tennis, whatever it is that people like to do to where you're not just moving in one motion. Because that's what happens when you're running. You just run in this straight motion, right? You want to move in different planes of motion. When you play basketball, you have to squat, you have to turn, you have to move your hips, you jump, you slide, all those different things, right? If your body's not prepared for that, tennis, you still do that. People play pickup soccer. You're still running, but now and when you're doing those different movement patterns and with the sports, you're working different muscles. Your core is getting stronger, your glute, like there's difference versus just running. And I don't care who you are, it's gotta be a little bit more fun.
Absolutely.
I don't care if you're playing ultimate frisbee or whatever it is, right? That's gotta be more fun than just running in a straight line for 10 minutes to 60 minutes to 2 hours or whatever, right?
Yeah. Definitely enjoy playing sports. When the world opens back up, I can't wait to get back out there and do some pick up basketball and those types of things. Those are things where as my weight began to balloon, I was doing less of it. But as I got healthier and able to probably do more, the world kind of shut down on me a little bit last year. So when
been waiting,
been itching. But so that's definitely something I think I'm going to incorporate back into like my workouts and stuff. Is just going to the gym and just running some pickup a couple times a week,
or cycling. Low impact once again. So you're cycling, you're on a bike outside. If you have a stationary bike or something like that, Peloton or something like that, it's there.
there.
You can do it. That's something that I incorporate in. So it's just mixing it up, and then there's cross training to where you are doing other stuff, not CrossFit. You could do CrossFit if you want to. It's a whole nother show. But cross training to where you do a little bit of running. Make sure that you are weight training to make sure that you are strengthening yourself, correcting those imbalances, getting stronger, being able. I mean, think about it. If you have an issue lunging, right? Should you be running?
No. That's just a bunch of lunges.
But I mean, if you don't have the structural strength to do proper lunges going forward, you probably shouldn't be running. You should be fixing that because that's your own body weight right there. Running's your own body weight, and you need to say, what's going on? Are my legs that weak? Do I have that much excess body fat that I can't do it? Is my core that, like, what's going on? Is it a mobility issue? So my calves are so tight? What's the problem? And once you correct all of those, then maybe you can go think about running.
Right.
Yeah.
All right. So what types of people should be running?
Yeah. So if you have minimal imbalances, you can do a lot of things in terms of body weight, like we were talking about in terms of lunging. You can squat. You can even hold yourself in a full plank position in terms of a push-up position.
Right.
You don't have any lingering injuries from previous, hip, knee, ankle. Then, yes, go out and run. Now, take it easy and build your way up. Even if you do have a strong, lean body, make sure that you're taking your time. Don't just go from 0 to 8 miles.
Right.
Don't try to go keep up with your friend who runs 5 miles, 3 miles.
Exactly.
Go run one. There's things that are called couch to 5K, and they build you up properly to where you're doing, half a mile, 1 mile, 1.5, 2 miles, and then they have it structured so that you are doing the proper amounts of intensity, and it kind of undulates to where it goes through the week. It's not something that where you're not going to do the same thing every day. If you did a long run at one point of the week, they might pair with another short run, and then you get an intermediate run, and then you build your way up like that.
Right.
So it has to be somebody whose body doesn't have anything to where they're like, hey, you haven't been denied for your what is it when you take the car?
Oh, your maintenance check or
No. I mean, for the
oil change?
No. When to get your sticker.
Oh, a rejection sticker.
But what's the
emissions test? A safety check.
Safety inspection.
Safety inspection.
Jeez,
There's
man,
a lot of things going on with the vehicle, man.
You let me get it out.
All right.
Yeah. So if you go and you fail your safety inspection, because they're saying, hey, you gotta get some new tires, or that's out. Then if that knee is acting up, or we're not seeing that you're moving properly, then you don't need to be running. And then also, so those are the people who should be running. Those are the people that are ready to run.
Okay.
And then also, you should still go do some research, whether it be a running coach. Some of these shoe stores where you get proper running shoes, they have running coaches there, or people who've collegiate runners and professional runners. They're going to let you know and see how you run. When you try the shoe on, they're going to see how you run, and just you maybe ask them if they don't volunteer the information, because the way that you run, again, it might cause an issue. So you're like, oh, I don't have any issues. And then you start running, and now you've caused an issue.
Right.
So just really, really, really take a look at that.
Yeah, definitely. All right.
Yeah. I'm not anti-run, but when we're talking about long distances, where we're talking about over 3 miles consistently, it's going to be a wear and tear on your body. You can talk to anybody who's former military, and they're going to tell you that they had a wear and tear on their body. And at some point, they're going to have to figure out another way of doing things. So, I mean, have you ever seen somebody running down the street and they just looked in pain? They're running for fun or fitness, but the movement pattern looked painful.
Yeah, I've definitely seen that. People who've run at interesting gaits.
Yeah, exactly.
Very interesting gaits in their strides and things like that. So that has definitely been something I've seen. So, but I have a question for you before we wrap this up. What about young people running long distances and things like that. How what impact on their bodies, who their bodies may not be as mature physically. How do you feel about? Because I've seen like maybe middle school age kids to younger high school age kids like running with their parents, running by themselves long distances in neighborhoods and things like that. Is that something that we should encourage or discourage from them for doing those things day in and day out? Or
you should encourage it because they're more likely to be in the proper place in terms of their weight. So they're less likely to be overweight. They're going to be less likely to have any serious issues. You know, you don't meet many 7th graders who have, torn ACLs.
Right.
Have hip issues, have IT band syndrome. You're not hearing that from that age group, right? So it's important that they keep doing those things. That's so yes, do it. Do it. That's why you have recess. Right?
Yeah.
You don't have that in high school and college, it's optional. But you should run, you should move in all directions. But if you have a child or somebody, a young person that that enjoys running, you're not pushing it on them, but they enjoy running, by all means do it, because you're going to keep them healthy. They're going to build cardiovascular strength. And then if they might be eating a Western diet, this will allow for them to combat that a little bit, because we are seeing a huge spike in childhood obesity. So yeah, running is not bad for children. It's something that we should the movement. So I encourage all movement for kids. If they like running, by all means go run, but I would never, just like an adult, I would never say go run if you don't like running. But no, there's no danger in it in terms of their bodies or anything like that.
Okay, good to go.
No.
Good to know.
I mean, when you were 12, did you have any issues with running?
I wasn't running miles, but no.
Did you have any knee pains?
I did not.
Exactly.
Not.
Yeah. So nope. By all means, run. When you're young. Yeah. And then when you get old, you gotta pick your spots and you gotta get a little bit more strategic in your approach. So please understand, running does not equal weight loss. Running helps you get in a caloric deficit, but to assure that you are losing weight, i.e. fat, not just weight, but fat, you have to be in a caloric deficit, and we got to make sure that we have the proper macronutrients in order. We just did our last episode on protein. Get enough protein, get yourself in a caloric deficit. That's the better you are with nutrition, the less movement really you have to do.
Right.
And I'm not encouraging anybody to not move, but you don't want to feel like you're on that hamster wheel every single day, because you ate 2 donuts this morning and then you put it in your food tracker and then you realize that it's 500 calories and then you're like, oh my God, I'm going to go run for 4 miles,
right?
Just to kind of wash even with that. You don't want to be in that, because you're going to lose that race.
Yep, absolutely, every time. Been there.
There we go.
Lost that race.
So, running sucks. I think so. Ernest thinks so. If you love running and it just brings joy to your heart, make sure you protect yourself with corrective exercises. Always strength train. Always have a combination of those things. And remember, you can swim, you can cycle, you can do those other things, and you won't lose your cardiovascular ability. So make sure that you are mixing it up just so you can protect your body from long-term wear and tear. Absolutely. And then that's really where I'm coming from, where I say running sucks.
Yep. Because I know my wife loves it.
Yeah.
Yeah, she loves to run, but she doesn't deal with the injuries and things like that. So she's in a position where she can do that consistently and find enjoyment in it. So it's an added bonus to her workout routine throughout the week. So
there you go.
More power to people like her. I cheer you on from the sideline.
From the sideline.
Yeah, boy.
Pass some water.
We out.
Thank you for listening to the Stronger Inside podcast. If you're listening on Spotify, follow us. If you're listening on Apple Podcast, then subscribe. Make sure you stay connected with us via social media on Instagram, Facebook, and Twitter at Stronger Inside Podcast. Remember, every like, comment, and share spreads the message of health, fitness, and wellness.
All right, my man.
Overtime. Back at it again. So this overtime session is going to be about athletes and politics. Maybe not even just athletes, but famous people in general and politics.
Celebrities.
Mm-hmm.
Celebrities.
Do you subscribe to the notion of shut up and dribble, or just entertain me and don't tell me I don't care about your political views one way or another?
You're saying as a fan?
As a fan, as an American citizen, as a taxpayer?
Well,
do you think people should, because they're famous, should their voices be louder, or should they even express themselves about their stance on anything political when their job is to entertain us?
Yeah. When it comes to that, it's two ways to look at it. You're famous for a reason.
Mm-hmm.
Well, some people, like we're talking about athletes, they are famous for the reason that talent.
Yes.
That talent has brought them the fame, the attention,
mm-hmm.
and that is the athletic ability, your actor, whatever it is, right?
Mm-hmm.
You're there. How did you get there? You dedicated your life to it.
Right.
Can you be well-versed in multiple topics?
Absolutely.
Possibly. But the type of time it takes to dedicate yourself to be a LeBron, a Lance Armstrong, a Ken Griffey Jr., whoever is Usain Bolt, whoever it is, right? That's their main thing that they're focused on.
Mm-hmm.
Michael Jordan, everybody, all these people have had different ways of going about the same topic.
Mm-hmm.
So can you really say that your opinion is, you've done the research to really speak? If you have, more power to you.
Mm-hmm.
Or if you have a great team around you who's done the research, which allows for you to kind of
use your platform,
great. But if you're not, then you're just like somebody else. You're just like the guy in the bar saying, that outfielder sucks. And
right.
You don't know what it takes to be that outfielder. You don't know the scheme or what's going on. So the same thing can go with politics, to where
the difference is between the guy in the bar, he's saying that to 15 people.
Now
you're saying it to 15 million people.
Exactly.
Yeah.
So now you could be uneducated in something and give your voice to it.
Mm-hmm.
And if you're not completely understanding what you're talking about, then you could be doing more harm than good. But if you want to, go right ahead. Just understand what comes with it. And I think those people already know that.
Right.
You get blamed for if you win the game or you lose the game. They've faced amazing media scrutiny. You go to their Twitter right now, you got somebody saying, I love you, you're the best ever. And then they have somebody else saying, I'm going to burn your house down. Right. So they're used to it.
Mm-hmm.
But what I would say is, I personally don't look for that.
Yeah.
I just don't.
Yeah.
I don't. And if you do step out and do that, more power to you, but you're going to pretty much put yourself, you're going to open yourself to criticism, even more criticism that has nothing to do with your sport or your talent.
Mm-hmm.
Yeah.
Yeah. So I hear what you're saying. And, you good?
Yeah.
All right. So yeah, I hear what you're saying, and I can understand a lot of that. I feel like everybody is entitled to an opinion. I feel like famous people's opinions tend to be louder because they reach more people.
Yeah.
But they don't have any opinions that are any different than the regular Joe Schmo out here. So I don't think that they should be muzzled just because they're famous. right?
Yeah.
But
let them show everybody that they're a dummy.
But like you said, there's levels to the criticism that you're going to receive and the backlash that you receive for voicing your opinion. Because undoubtedly, there's someone who likes you for your acting ability, someone who likes you for your ability to put a ball in a circle, to put a ball across the goal line, that isn't going to like you because of your political view. And so if you understand that and can accept that, then, like you said, more power to you.
Yeah.
But and then you have like you said, when you're not well versed in the topic at hand, and you may be speaking passionately, but maybe not with the full scope of information about a certain topic. And then you can fall into a category where you kind of can be made to look the fool. And we've seen that also. Even with I may have, like, for instance, Cardi B and Tommy Lauren. Is that her name?
Yeah.
Yeah. So I mean, they had a back and forth a few different times. And you may not agree with the political views of one or the other, but you could probably say that one of them made the other one look kind of foolish.
Yeah.
In that, because somebody came with facts and the other person, when they were presented with facts or presented with information, they kind of went to a name calling type of situation where it was like, well, you said X, Y, and Z. Oh, well, you ugly. Yeah. And that's when it kind of devolves into when you kind of don't know what you're talking about. But when you can stay on the facts and have a honest debate, even if they are clashing, if two sides come together and they're clashing, we don't have to agree, but we can respect the other person's opinion on a certain subject. But that opinion has to be an informed opinion.
Yeah, it has to be informed. It has to be informed, and you have to. I mean, this is the thing. Think about there's a technical foul in a basketball game.
Mm-hmm.
They will get a guy off the bench who's the statistically best shooter to go shoot the shot. And then that's it. He's the man for the job.
Man for the job.
We have enough people for most jobs. So I understand using your voice, and, you know, if you feel like there's injustice and things like that, I understand the difference. But to, like, actively try to do something, it's almost like you're going to step on the toes of somebody else who's already doing that.
Right.
You know what I mean? There's already somebody doing this stuff who would be in your camp and in your corner, and maybe you should just, if you feel that passionately about this, go link up with them so that they can continue doing it. Maybe they need somebody like you to shed a light on what they do.
Right.
Because it's like, hey, I've been working on this project for 15 years. I'm just not selling Gatorade and Nikes.
Right.
You sell Gatorade and Nikes. You have a similar opinion as me. Let's work together and let me do this. That's what we probably need a little bit more of versus somebody just saying, you know, I'm this person, I'm in this arena, and then I'm just going to jump out here and start talking about this arena.
Right.
You know, I went platinum here, and I'm going to tell you all about this. I personally don't care for that. And a lot of times it's a setup, because if you're being invited places to speak and you're not one of the people who are well-versed in it, it's probably for a reason.
Just to get butts to the seats.
No, to embarrass you.
Nah.
Or the people that you are defending or representing, because now you're speaking for them. For example, you know, like a Cardi B. Cardi B seems like her heart's in the right place. She speaks for people who, you know, have been victims of injustice, however you want to paint it in this country, but she doesn't know how to do it. She should actually decline invitations and say, no, why don't you go talk to yada, 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 and they'll do it better, because I'm better at
yada, yada,
yada, yada, yada on BET, MTV, making music. I'm better at that.
Right.
So, but that's not what we do.
We say, oh, yeah, I'll come talk.